Surgery is just one tool. It's time to put the other tools in the toolbox because it's your body, your health, your life.
2,000 years later.
I get it. It hurts. No one's talking about it. What the heck can we do? I need to poop. So in this video, we're going to talk about how, after bariatric surgery, so many of us, I read about it, I hear about it, I experienced it myself. After surgery, especially right after surgery, constipation is an issue and it hurts and you think you're never going to go again and you just desperately want some help. So before we get into this, I am not a doctor. I am not a poop specialist in any means. I'm just talking from my own experience, my own research that I've done on this topic. I know it's a super important topic. Don't make any dietary health-related changes unless you talk to that bariatric surgeon or doctor. But I just want to talk about this topic because people just aren't talking about it and we all experience it. And when we're in it, OMG, it's a tough, tough road. So let's talk about it. Remind you, talk to your surgeon. If you think you need to make some changes or you're questioning it in any situation that you are at a serious state, then of course, talk to your surgeon. You need to get help. Don't push it too far. But we're going to talk about constipation. We're going to talk about maybe some things we can try that'll help us get moving literally again. So where does poop come from? Let's talk about it. Poop is gross. Like really, seriously, it is gross. And as grown-ups, we probably hate to even talk about it, but we got to talk about it. It hurts. Having a bowel movement really is about all that kind of leftover food and waste that we eat, but our body doesn't use. In a nutshell, that's what having a bowel movement is. So first things first, constipation is totally normal after bariatric surgery. Most of us were on liquid diets or a very low carb diet before we had surgery to help shrink that liver. And we still are on liquid diets after the surgery for most of us. Not everybody's program's a little bit different. But the decrease in the bowel motion frequency and the change towards firmer stools probably was happening even before your surgery. But now we even have a longer kind of prolonged intestinal transit time after bariatric surgery. So what that means is that there's been a decrease in the actual frequency of having a bowel movement and also the reduction in dietary fiber. Because we're having liquid diets, we're not getting a lot of dietary fiber is most likely and the reason or the contributor factor to the reason why we're feeling so constipated now. And for many of us now, compared to before our pre-op diet, we're having smaller portions. So that's also contributing to what we're feeling right now and the reason why we're feeling constipated. So like I said, this is one of the most common side effects. I wouldn't call it a complication because it is pretty normal for most of us after surgery. But it's the biggest complaint people have immediately after surgery, at least that first week, maybe even 2 weeks for some people. Having hard stools or not being able to release or have a bowel movement in that doesn't occur less than a week, once a week, is considered constipation. So really, constipation, the technical term constipation is when we haven't had a release or a bowel movement in going on a week. Some people believe they're experiencing constipation when they don't have a bowel movement every day. Like some of us are used to having or going to the bathroom every single day. So we might consider that constipation. No matter whatever we call it, is typically after bariatric surgery. Bowel movements are just not the same as before surgery. But with that being said, it doesn't mean it's easy. So understanding how to possibly prevent it even, or what the causes and the treatment is, or gaining knowledge around it, can actually help our mind be at ease. So constipation can become like more severe the longer it lasts. More water is absorbed back into the bloodstream, causing the stool to harden in the colon, the large intestine, which, as we know, comes with a little or even a lot of discomfort. And high amounts of gas, those farts, may also be associated with certain levels of constipation. Our GI tract is actually a series of muscles working together to, in a synchronized fashion, to kind of move together, grind the food, and move it towards actual excretion. So many factors influence our ability to go, including illness, the types of food we eat, our activity level, nerve transmission, hydration, and even our individual biology, to name a few. So when we have the presence of food anywhere along our GI tract, it acts as a stimulus for the digestive process. And when things are kind of humming along perfectly, we don't even give much thought to it. But when things seem to slow down and become a crawl, and finding the right regime, or kind of finding the right process or strategy to get you back on track, takes some trial and error. In many cases, the reasons or the causes for having constipation after having weight loss surgery is anesthesia and pain medication are kind of the main causes for constipation following bariatric surgery. Anesthesia and pain medication actually work by suppressing the nervous system. It also blocks nerve signals to the GI tract, your GI tract, your digestive tract, resulting kind of in a temporary shutdown of sorts. Another cause is a severe reduction in food consumption and drink consumption. And isn't that what we've kind of experienced a little bit before surgery, but definitely right after surgery? So our smaller stomach, or our rerouting of our intestines, is kind of the important reason why we have bariatric surgery. And it works well for us for achieving what we want, the weight loss. However, this also translates into a reduction in fluid and fiber intake. Since fluids, water, and fiber are kind of the two main drivers for a successful bowel function, that reduction in supply can actually force our body to slow way down. We also, for most of us, have had an increased intake of protein and other supplements and vitamins, which is a staple for most of us, our bariatric patients, before surgery and even right after surgery. Those products can be binding, and they contribute to constipation for most of us. Because liquid concentrated protein sources like our shakes contain little or no fiber, it just kind of leads to the inevitable of that feeling of hardened stools or constipation. And as we talked about, medications, other medications on top of our pain medications, especially any kind of tranquilizers for sure, chronic pain medications or antidepressants, even our iron supplements can impact our bowel movements and lead to constipation. And on the kind of subject of pain medications, some of us were given narcotics, especially, and some of us even continue after post-op. These meds are discontinued as soon as possible after a bariatric surgery, as to not to contribute to constipation. But for some of us, we need them a little bit longer. So the longer we have them in use, the more that's going to contribute to constipation. Now, I'm not saying go off them, have this conversation with your bariatric surgery. I just want you to have the knowledge to know that these medications, our vitamin supplements, iron supplements, all the things that we're doing in combination of the lack of hydration, the increase in protein, all contribute to constipation. right after bariatric surgery, and even before that, some of us have weak abdominal muscles. So that kind of goes against us as well. And now we're kind of there, it's not working for us. Our abdominal muscles are in pain, or they're a little weaker, and they're just not working for us because we need kind of that movement. We feel super pain, so we kind of back off from the feeling of wanting to go, or if we're trying to go, our muscles, our abdominal muscles are so sore, and we just kind of back off, and we don't have the strength or the muscle kind of strength to go through the movement. So another good reason why, there's many reasons why we need to keep up our hydration and work at it consistently, is adequate fluid intake, water intake will moisten the stool and keep the feces moving. So that is one main reason. There's many main reasons you do not want to get dehydrated, but especially if you're feeling constipated, you have to work on getting that water into your body. Another cause is the lack of exercise. Just movement in general will help with bowel movement. So that might be a reason. Now we're trying to recover, especially right after surgery. Lack of exercise, even for some of us before surgery, but movement is really important for getting those bowels moving themselves. Of course, we want to try to prevent constipation as much as we can before, because a lot of us do have potential problems with hemorrhoids, hernias, intestinal blockages, potential. It's important to really prevent constipation if we can before it happens. So before we talk about some possible things to help you kind of get moving again, literally get moving again, I just want to remind you that this usually is a temporary thing. You don't want to get too, I guess what I'm trying to say is you don't want to make the problem worse. There are things to help you, like products out there, milk of magnesia. Some people even consider having enemas, Dulcolax, suppositories. There's all kinds of products to help you. Laxatives. I just want you to really have a conversation with your surgeon. This is super important that you don't become your own doctor and self-diagnose or self-treat too much, because yes, I get it. It hurts. You want it moving. But if you take products that do not work for you, or maybe work too fast, you might be doing more damage than you are doing good. So if you do feel that your constipation problem is super serious and it continues after 2 weeks, you might have to really consider talking to your bariatric surgeon for sure. Call your surgeon's office. Do not take laxatives on a regular basis. It will only do damage. Your bowels could become dependent on them, and you might hinder or hurt having normal bowel movements moving forward. So talk to your surgeon. If it's serious, have the call, make the call. Don't be embarrassed. They're used to it. This is normal. So if you really do feel like you have a serious problem, you need to call. But in most cases, this is kind of a normal side effect. It's important to remember and recognize that some bowel function problems are not related to bariatric surgery either. So you don't want to make an automatic assumption. If you think it's serious, call your doctor. But some of these things, it just takes time. I know when you're in it, you can't believe you're going to get out of it. But you want to just, love yourself through it. But also, let's talk about some things that maybe can help you relieve that pain or get you moving again. So some things to consider and evaluate before we kind of get into some of the treatments or suggestions to get yourself moving again is I want you to kind of really evaluate your poop. Seriously, I know that sounds silly, but it's a good practice after surgery as well, and a good practice as you keep moving forward. Some things to evaluate. I'm going to tell you a secret. I look at my poop every time I go. I look at it because it's a really good indication of what's going on in your body. So some things to consider is, number one, color. So normally a good color is brown. It can be darker brown, it can be lighter brown, but a normal color typically is brown. Black, red, or maroon is not normal. If you do see that, you need to contact a healthcare provider, your surgeon, your doctor. This is something you need to take seriously. Now that I say that, yes, for sure. If those colors are present, I don't care. There's nothing I'm going to say or not. You need to contact your healthcare provider. But if you did by chance eat beets, a good story of mine is like beets. Beets will show redness in your poop. Now, if your poop starts to look kind of whitish, grayish, very, very light, like super light, that usually indicates that it's an inability to absorb certain nutrients, and that also needs to be in consideration. And sometimes, like a yellow consistency, white is usually the inability of nutrients, but that grayish, really light poop might indicate an issue with your bile production. Normal consistency of poop is typically soft and smooth, easy to pass, but still compact. So soft and smooth, easy to pass, but still compact. Abnormal, or something to be aware of and maybe contact a healthcare professional, is small, hard pellets. Now, right after bariatric surgery and when you kind of first go, you might experience that. But as you kind of moving forward, small, hard pellets may mean your fiber intake is too low, or there's some blockage inside your colon. Additionally, like we've been talking about, constipation is usually the number one complaint, but some of us might experience a real sudden onset of diarrhea. Now, that's something that you need to talk to your healthcare professional, especially if it's sudden and you haven't really made any other changes to your diet. Anything that's sudden to do with your bowel movements is something to talk to your healthcare professional about. A normal poop is usually the sausage-like shape. It typically does not break up in the water of the toilet bowl. So if you see a good sausage, thumbs up. But if you really do see consistently like a sausage and then it gets really small, it's just something to consider, and you need to talk to your healthcare professional about. If you have concerns or feel like it's just not right, better safe than sorry always. Definitely after 2 weeks after bariatric surgery and you still have not gone and had a bowel movement, you need to make an appointment. There's nothing to be embarrassed about. Now, I know depending on your post-op status, especially right after bariatric surgery, this usually is a no-no, but every program is different. Every bariatric surgeon has a different protocol. But if you might want to try having a really small cup of coffee, caffeinated coffee or tea, it could just provide enough stimulation to prevent things from getting backed up. But like I said, you don't want to have too much too quickly if you're even allowed to have it, because it might be too much, too hyper, too stimulating for your digestive tract. Now, for some patients that are not allowed to have coffee or caffeinated tea, you could try a simple cup of warm water with plenty of lemon squeezed in it. Now, you can try an over-the-counter laxative such as Miralax or something like that. It might just help you kind of wake up the nerves and the muscles. But just remember, you do not want to become dependent on them. You don't want to take too many, and you don't want to turn it into something more severe than it is right now. If you are on an extra iron supplement, it might be necessary to take a stool softener. I always promote the natural forms of laxatives and or stool softeners as much as you possibly can. They're a little bit more expensive, but they're just easier on your body. And remember, we have compromised our digestive tracts, our stomachs, our intestines, and that all is connected. So you just want to be as natural as possible if you can. Now, remember, drink more fluids, eat more fiber if you can. You probably are on a liquid shake, but there are protein shakes that have more fiber. So that might be something to look into. Look at the fiber content in your protein shake. So the more fiber usually helps things get moving as well. I'm going to say it again because it's so super important to be hydrated. I know right after bariatric surgery, it's so hard to get that 64 ounces of water in. It's difficult to even consume water, but you need to make it a goal what I do is, or what I did is, I had a little 1 ounce cup that I made sure I took every kind of 10 minutes of an hour time frame. So I would try to get, 6 of them in that hour. I just made it my job. I know it hurts, but I knew hydration was super important for many things, but especially for constipation. Adding some healthy fat back into your diet, just a little bit, can help things get moving. So if you're on a liquid diet, maybe you need to melt some butter, some avocado oil, some MCT oil. I do not promote bad fats. So if you want to check out my bad fats video and determine which ones are good fats and which ones are bad fats. But maybe even whipping up an avocado in your blender, just adding a little bit of fat usually can help our bowels to get moving. Remember, don't hold it in. I know we're in pain, our abdominal muscles are in pain, but don't hold it in. Something I hear quite frequently is that you have an urge to go, but you're in pain. And so you fight it, you fight against it. Ignoring urges to go, even if nothing comes from it, ignoring the urges to go regularly can lead to chronic and severe constipation, coupled with painful gas and bloating. So it's super important to not to don't ignore your urges to go. Try as much as you can. On the flip side too, don't force or strain the process as well, because you want to be very careful that you don't tear, like have fissures. You don't want to tear, and you don't want to make your hemorrhoids get worse if possible. So you kind of have to find that balance. Do not just like avoid the urge. Make sure you're trying to go, but don't strain and push too much. Another thing you can try is squatting. I know right after bariatric surgery is the last thing you want to do, but try squatting. Or have you heard of such a thing as the squatty pot? You don't necessarily have to buy that, but if you have a stool that you can raise your feet up when you're on the toilet, it puts your body into a position that's more of a natural way of releasing your feces. So try squatting, try raising your feet when you're on the toilet, so that maybe that movement, it just helps you to empty your bowels. Some people have tried using heating pads, putting heating pads on your abdominal area, your lower abdominal, just kind of every once in a while. Kind of that kind of feeling of warmth can stimulate the muscles. There's kind of smooth moving teas out there. Do what you need to do. More of a feeling than it is an actual activity. What do I mean by that is that there isn't a lot of stool in there for a lot of us. So you cleaned yourself out probably before surgery. It's just more the feeling. And I get that that's hard to hear. It's more the feeling, and with time that usually passes. But like I said, if you feel it's a concern, talk to your doctor, call them now. Don't be embarrassed. Better safe than sorry. Take care of you. And here's to having a poop.